Welcome back. The Ministry of Health and Wellness has launched its annual vector awareness campaign. With the threats of dengue fever, chikungunya virus, and now the Zika virus looming with the advent of the rainy season, the ministry's message is centered on companies and communities working together to eradicate threats. Speaking at the launch of the Vector Awareness Campaign Tuesday, the Permanent Secretary Corinthia Thomas employed all St. Lucians to engage in best practices in order to eradicate all vectors. This, she said, is very possible.
In fact, Uruguay, if you were to do the research, boasts of having eradicated the Aedes aegypti mosquito in some of its spots. Other territories report significant results as a consequence of these environmentally friendly interventions. In St. Lucia, our collective efforts, although have proven to be very successful in reducing the populations and by extension reducing the incidence of vector-borne diseases, there is need to get everyone, and I do mean everyone, to undertake these interventions.
And Minister Alvina Reynolds underscored the effects of vector-borne diseases can have on the healthcare system and the economy.
These vector-borne diseases proliferate in regions of low sanitation standards with questionable water storage practices. These diseases affect our national economy, our tourism sector, which we rely on, the health care system, and our families. I want to speak of the healthcare system, the number of visits to health centers, polyclinics, and hospitals, medications being dispersed, hospitalizations, and you name it, the way it affects the healthcare system, the number of people you see at any one time sitting to see a medical officer, the number of off days, sick leave, etc. Then it can affect productivity. How much do we give in terms of being productive if we are unwell as a result of a mosquito or a rat?
In 2011, after Hurricane Thomas, at the height of the dengue fever epidemic, there were 749 confirmed cases, 169 suspected cases, and 3 deaths. In 2013, there were 282 cases confirmed with 110 suspected. Last year, there was a decrease with 90 confirmed cases and 77 suspected cases with 1 death.